Hi, everyone. Thanks for joining us, and welcome to the second episode in our new webinar series, Oncology Nurse Hour. I'm Amanda Holman, and joining me is Kristen Johnson, our Chief Nursing Officer and Oncology expert. We work for Massive Bio, concierge clinical trial enrollment service where we connect patients to clinical trials. We're here to discuss cancer types and answer any questions you want to know. This week's theme is pancreatic cancer, and we're based on community input. We've created a Q&A. If you have any pancreatic cancer questions now or that come up during the chat, please write them in the Facebook chat and we'll make sure to take some time to answer questions at the end. And before we begin, Kristen, can you tell us a little more about yourself?
Sure. Thank you so much, Amanda. Hi, everyone. As Amanda mentioned, my name is Kristen Johnston, and I'm a nurse with over 12 years of oncology experience. I have knowledge in both solid and hematologic tumors, with direct patient care, as well as extensive clinical trial experience, including trial enrollment and recruitment. Very happy to be here today.
Thanks, Kristen. We're really glad you're here too. So jumping right in and, starting at the beginning, can you tell us what pancreatic cancer is exactly?
Sure. So pancreatic cancer is a type of cancer that begins in the tissues of the pancreas, which is an organ in the abdomen that's located behind the lower part of the stomach. So the pancreas releases enzymes that aid in digestion and produces hormones that actually help manage blood sugar levels. The pancreas is actually made up of cells, and usually cells divide to form new cells when the body needs them. And then when they get old, they die and new cells will take their place. However, sometimes the process does not work, and the new cells form when the body does not actually need them. And then these abnormal cells in the pancreas grow and then divide out of control and form a tumor.
Are there different types?
Sure. So there are two different types of pancreatic tumors, exocrine or endocrine, also known as neuroendocrine. The type of pancreatic cancer is determined by the type of cell in which it starts. So about 93% of pancreatic cancers are exocrine tumors, with the most common type being adenocarcinoma. And about 7% are neuroendocrine tumors, which are often a little bit slower growing. But it is very important to know what type of tumor you have, because each type will respond differently to treatments.
If they have different treatments based on types, do symptoms differ as well? And would you also be able to tell us a bit about typical symptoms for pancreatic cancer?
Sure, that's a good question, and one that many patients are asking. Unfortunately, though, pancreatic cancer is rarely detected in the early stages, which is when it is most curable. And because symptoms don't usually appear until it's spread to other major organs in the body. That being said, the most common symptoms that are experienced with pancreatic cancer can include pain in the abdomen or back, jaundice, which is yellowing of the skin in the eyes, which can also lead to itching, loss of appetite or nausea, which can also lead to weight loss. However, it should be noted that symptoms like recurrent pancreatitis or a new onset of diabetes, smoking, obesity, dietary factors, alcohol abuse, age, ethnicity, family history, genetic factors, H. pylori infections, and non-O blood types are all risks of pancreatic cancer as well.
So it sounds like you want to try to catch it early. And if you have, certain of those risk factors, it's probably worth looking into if you have any of the above symptoms.
Absolutely. And most times, hopefully, they will not lead to pancreatic cancer or may not be symptoms of pancreatic cancer, but something else going on. But it's always good to talk to your doctor and have it looked into and checked out.
Do the symptoms differ at all in males and females?
So that's a good question. And symptoms don't necessarily differ between males and females, but it has been seen that men are at a slightly higher risk of developing pancreatic cancer due to higher tobacco use.
It's really interesting. Mm-hmm. I know I always think of or tobacco use being linked to lung cancer, but It's really interesting to know that it can also lead to other forms of cancer as well.
Exactly. Unfortunately, you don't want to smoke at all because it can lead to many, many different complications, including cancers.
How fast, this is an audience question actually, how fast does pancreatic cancer spread?
That's hard to say because every patient is different and progression can occur at different rates, and treatment that works for one patient may not work for another and vice versa. But researchers have estimated that the average stage 1 pancreatic cancer progresses to stage 4 in just over a year or less if it's left untreated. So the earlier the pancreatic cancer is diagnosed and treated, the better the prognosis will be.
That makes sense. Definitely sounds like a fast growing cancer.
Yeah.
You mentioned different treatments. Would you be able to tell us about some of the traditional treatments and therapies?
Sure. So treatment for pancreatic cancer depends on the stage of the disease at the time of the diagnosis. So if a patient is diagnosed at an early stage, they could be eligible for surgical removal of the tumor, which is also known as a Whipple procedure. However, not every patient with an early stage diagnosis is eligible for surgery. So many things are taken into account, such as the exact location of the tumor, the patient's general health, their age, among other things, of course. So at any time, though, I should mention a clinical trial is always a feasible option for consideration. Clinical trials study new or already approved treatments with new drugs and can be considered throughout every stage of the disease. Other treatments that are available include chemotherapy, immunotherapy, radiation, or targeted therapies if biomarker testing has been performed.
Thanks, Kristen. Before we move on to the next question, I just wanted to let everyone know that if you are considering clinical trials, check out the link in the comments and head right there to see if a pancreatic cancer clinical trial might be right for you. So, Kristen, from your last answer, you mentioned chemotherapy is a treatment option. Are there any currently approved therapies that are frequently used?
Of course. So there are a few drugs and combinations of drugs that have successfully completed the clinical trial process and are approved for the treatment of pancreatic cancer. The most commonly utilized combinations for first and second line treatments are FOLFIRINOX, which is made up of 5-FU, irinotecan, and oxaliplatin, or gemcitabine and Abraxane. These treatments or combination of treatments are also found in many first or second line clinical trials throughout the US. There are, of course, other approved options available as well for treatment of pancreatic cancer, but physicians tend to consider these either alone or in a clinical trial.
You also mentioned that targeted therapies are an option if biomarker testing has been performed. Would you be able to explain quickly what a biomarker is? And then are there any common biomarkers seen in pancreatic cancer?
Sure, that's a great question. Cancer biomarkers are biological molecules produced by the body or tumor in a person with cancer. So biomarker testing helps to characterize alterations in the tumor. Over the past decade or so, the genomic landscape of pancreatic ductal adenocarcinoma has been studied, and BRCA mutations have been seen as a target for the development of more effective therapies. In fact, alterations in germline BRCA and PALB2 are detected in approximately 5 to 9% of patients with pancreatic ductal adenocarcinoma. So now in familial pancreatic cancer, which is also known as having 2 or more first-degree relatives affected with pancreatic cancer, the BRCA2 mutations are actually found in about 5 to 10% of the cases, and the BRCA1 mutations in approximately 1%. That being said, BRCA1 and 2 are the most common causes of familial pancreatic cancer.
And BRCA mutations can, 1, lead to other cancers as well, correct? Or 2, if you have a family history of BRCA mutations causing other cancers, would you say it's a good idea to also get screened for yourself for pancreatic cancer?
Absolutely, absolutely. So if you see a BRCA mutation in breast cancer or prostate cancer, you should really be screened for all for the other types of cancer. So if you have breast cancer, your family members should be screened for pancreatic or prostate cancer if you have that BRCA mutation.
Thanks, Kristen.
Mm-hmm.
Would you be able to tell us a bit more about clinical trials?
Sure. So there are many different clinical trials available for the treatment of pancreatic cancer throughout all stages of the disease. In fact, there are currently over 360 actively recruiting trials for pancreatic cancer alone in the United States. Every approved treatment that is currently available to treat pancreatic cancer has gone through a clinical trial. Treatments available through clinical trials for pancreatic cancer can involve new drugs that are being tested for the first time, or a combination of already approved drugs with new drugs that are being tested. So clinical trials for pancreatic cancer are necessary to determine if new treatments are actually beneficial to those patients.
Before I ask our last question, I just wanted to remind the audience, if you have any questions, now's the time. Please write them in the chat for us. So related to clinical trials and treatments, we've had some patients wonder if they should try chemo and radiation before they enroll in a clinical trial.
That's a good question. And many clinical trials for pancreatic cancer patients include already approved chemotherapy or a combination of treatment with chemotherapy and or radiation. A clinical trial should actually be considered from the point of diagnosis and does not have to only be considered at times of progression or in late stage. It's very important to keep on top of this disease specifically at all times. And clinical trials can be an excellent source to do this.
Thank you so much. Again, if you have any questions about clinical trials, if you're interested, if you want to learn more, check out the link in the chat. Anyone is happy to talk to you and give you some more information on how it might be helpful for you. We'd like to thank everyone for coming out and listening to our pancreatic cancer webinar today. And if you have any questions after this, again, still feel free to write them in the comments and we'll make sure someone gets back to you. Kristen, thank you so much for your time.
Thank you so much, Amanda.
For having me here. All right, and that will conclude our webinar for today.